Good morning, everyone. My name is Christy Zamani. I'm the executive director for Day One, where we build healthy, vibrant cities by empowering youth and advancing public health. I'm here today with my community partners from the Pasadena Police Department, Drug Enforcement Agency, the RAD Coalition, the Pasadena Public Health Department, Los Angeles County Department of Public Health, SAPSI, as well as some student leaders from our community who are staunch supporters of building better communities for all. So we're here today with our purpose is to increase awareness for National Drug Take Back Day, a day to remind the public not to keep unused prescription drugs at home, to not flush them down the toilet, to keep our environment safe, our water supply, our marine life, and to not keep it at home for misuse and abuse. You know, children, the number one way they're accessing this medication is through home cabinets, drawers. Some of us keep the medicine in a refrigerator or a bedside cabinet. So we need to be more vigilant and do our due diligence to keep these medications safe and out of the wrong hands. Every year in LA County, prescription drug misuse is responsible for 4,000 deaths, 9,000 emergency room visits, over 14,000 hospital visits, and 70% of the abuses takes place from family. Access point is family or friends. So let me break that down to make it a little bit more tangible for you. 1 out of 20 adults misuse prescription drugs. And what's even more frightening than that is that 1 in 5 teens misuse prescription drugs. So we need to work together as a community, as a whole, to do our work to keep our community safe and our kids safe. It starts with parents, it starts at home. So I really encourage you to be a part of the solution. And to go into that a little bit more, I have 2 student leaders. First, I'd like to invite up Chris Silva.
Hello everyone, good morning. My name is Christopher Silva. I'm 16 years old. I go to Blair High School. I'm here today to talk about the impact prescription drugs has on our communities, schools, and my peers. I personally know many students who use pills to cope with the things they're going through in life right now, but some also use them for fun or just to be cool. Most of them get pills from home, as Christy said prior, and they also get them from a friend. As youth, we're not thinking about tomorrow. We're usually just thinking about what is going to get us through the day today. I'm lucky that I'm involved with so many healthy outlets that keep me busy and surrounded by encouraging mentors who keep my head on straight. They really help me. They're awesome. I just feel like we need more of this as youth. We need more healthy mentors, people we can look up to that can guide us and steer us in the right way. Me llamo Christopher Silva. Yo creo que esta es una cosa importante que mirar, es un problema en la comunidad. Obviamente muchas personas ven personas que usan drogas, y muchas de las drogas son medicina y las pueden agarrar, es muy accesible, lo puedes agarrar de tu amigo, de la casa. También es un problema de verdad porque ver un niño gastar su vida en drogas es muy terrible, porque nosotros como el futuro de ustedes tenemos que tener la cabeza bien puesta en nuestros hombros porque tenemos que saber lo que tenemos que hacer en el futuro.
Good morning, everyone. My name is Vanessa, 17 years old, and I go to Marshall Fundamental. I'm here today because I care about my community and keeping it safe. Getting pills is not that hard. Youth are getting them from friends, family, and medicine cabinets. In low-income neighborhoods, we know that medicine is expensive, so it's hardly ever thrown out. We keep it in case someone in the family doesn't have insurance and they get sick. We need to stop doing that. Addiction is a serious issue. It's also a sickness, and holding on to drugs contributes to it. Please do what's right and secure your medicine so it doesn't end up addicting another child. We need to do it better.
My name is Detective Jeffrey Stark with Pasadena PD. Today I'm proud to announce that the Pasadena Police Department will again be partnering with Day One, the Rethinking Drugs and Alcohol Coalition, and the Los Angeles Department of Public Health in hosting National Prescription Take Back Day. The event is scheduled for Saturday, April 27th from 10 a.m. to 2 p.m. right here in front of the police department. The public is encouraged to drop off your unwanted, unused, or expired prescription medication or over-the-counter medication. It is important to note that no questions will be asked of you, no information will be asked of you, no judgment will be given. We just want this unused or unwanted prescription medication turned over in a safe manner. Thank you.
Good morning. My name is Michael Davis. I'm an assistant special agent in charge with the Drug Enforcement Administration in Los Angeles. And this Saturday marks our 17th National Take Back Day. This is the opportunity for the public to go through their homes, go through their medicine cabinets, and clear out all unused, unwanted, and expired prescription medication, and to bring them to one of 47 collection sites throughout LA County to dispose of them in a safe and completely anonymous way. Too often these prescription drugs get into the wrong hands and they lead to tragic events such as overdoses and overdose deaths. Last year, in 2017, we had over 560 opioid-related deaths in LA County. And DEA, of course, is partnering with our federal, state, and local partners to lower that number. Again, we have over 47 sites throughout LA County. To find your nearest site, all you need to do is go to www.deatakeback.com. And you can find your nearest collection site for this Saturday. The hours are 10 a.m. to 2 p.m.
My name is Dr. Ying Ying Go. I'm the health officer for the City of Pasadena Public Health Department. I'd like to thank our police department and Day One for their commitment to offering and promoting Prescription Drug Take Back Day to our community. It is very important that we all participate in this drug take back program because drug overdose is now the leading cause of injury-related deaths in the United States. On average, 115 Americans die every day from opioid overdose. How does this relate to each of us individually? 44% of Americans say that they personally know someone who's been addicted to prescription painkillers. We can each play an important role in addressing this public health problem. We know that about 1 in 5 individuals who started using illicit drugs in the past year reported that their first drug was prescription opioids, and that the majority of abused prescription drugs come from the home cabinets of family and friends. That means that by emptying your cabinet of prescription medication, you can help reduce the amount of these drugs that are accessible to our loved ones. In public health, we recognize that substance addiction is not a moral failing, but rather it is a chronic disease that must be treated with compassion and urgency. The Pasadena Public Health Department is a partner with the SafeMed LA Prescription Drug Abuse Coalition in LA County. This coalition is working on multiple components of a broad prescription drug abuse and overdose death reduction strategy that includes safe prescription drug disposal that we are highlighting today, and also other strategies such as education and training of healthcare professionals and of the public. In addition, the Pasadena Public Health Department is assisting with local efforts, training on opioid overdose response, and distribution of naloxone, which is a safe antidote to opioid overdose. And we're providing it to community partners if needed in schools, clinics, and community facilities. The department also provides an outpatient substance abuse treatment program available to the community. So I urge our community members to learn more about this problem, to find out what you can do to help. Please participate in the Prescription Drug Take Back Day on Saturday. And you can visit the website for the U.S. Centers for Disease Control and Prevention at cdc.gov, or contact the Pasadena Public Health Department for more information. Thank you.
RAD was established in 2012 to help reduce access to alcohol and other drugs and keep our communities safe. In order to reduce prescription drug misuse and abuse, we developed a really handy tool called the EmpowerRx tool. Christy and our students spoke earlier about our youth population and how we're concerned about them, but we're also really concerned about our senior population. They have access to prescription medication and oftentimes they don't know how to advocate for themselves. So the really handy tool empowers them to ask questions of their doctors, their pharmacists, and also empowers them to get rid of their medications medications once they're expired, unused, or unwanted. So last year we partnered with the DEA, the Los Angeles Department of Public Health Substance Abuse Prevention and Control, and local law enforcement partners, and we had over 30 collection sites throughout LA County. This year we have over 40 sites throughout the county, so no matter where you are in LA County, there is a site near you. Last year we collected over 20,000 pounds of prescription drugs. This year we hope to beat that, so join us this Saturday, 9 a.m. to 2 p.m. Anywhere in the county, you can find a location nearest you by looking at the DEA website, deatakeback.com. There are also locations throughout LA County that accept medications year-round. You can check it out on our website, radsgv.org, for more information on take-back locations that are open year-round.